Welcome back, everyone. Now at 6, local advocates for death with dignity are speaking up, hoping to bring awareness to a new bill that's working its way through the State House. It is called the End of Life Options Act and would allow terminally ill patients more freedom when it comes to their health care. They're hoping that it'll be voted on before the legislative session ends. And Western Mass News reporter Sabrina Riley has more.
To allow people to have the option of avoiding severe pain and suffering at the end of their illness.
That's the option the advocates with Death with Dignity Western Mass are pushing for with a state bill called End of Life Options Act. The bill is currently in the Joint Committee on Healthcare Financing, awaiting votes from both the House and the Senate.
This is something that's been needed, and that's why people have been fighting for these laws for over 30 years.
If passed and Governor Charlie Baker signs it into law, Massachusetts will become the 10th state to allow terminally ill patients the freedom to choose what's known as medical compassionate aid in dying.
It's a national phenomenon. It's growing. Canada passed a law nationally, not just for one state or province.
Western Mass Death with Dignity Director John Berkowitz tells Western Mass News that the likelihood of this passing in the Bay State has never been higher.
Both senators, Senator Eric Lesser and Senator Jim Welch, are sponsors of this bill. And many state reps, Carlos Gonzalez, Bud Williams, Brian Ash from Long Meadow and other towns, Aaron Vega from Holyoke. Many people are supportive.
This is an act that's been introduced for the past 10 years, but this is the first time that it's passed in the Joint Committee on Public Health. If everything goes according to plan and it passes through the Ways and Means Committee, the bill will be on its way to the House by July 31st and voted on this fall.
The bill doesn't force anyone to do anything. It's clearly, as I say, a matter of personal liberty. I can't see any strong argument really against it.
While this issue received pushback as a ballot option in 2012, Dr. David Clive explained why he's in support of the bill.
And I think it's also really a matter of personal choice, personal liberty. Everyone's entitled to their opinions on how to conduct the end of life. I also, as a physician, feel that it is not in any way antithetical to the ideals of the profession, which is first and foremost to relieve suffering and provide comfort.
For Western Mass News, I'm Sabrina Riley.